Hi, my name is Rachel Holmes, and my thesis is on the utilization of telehealth for pediatric and adolescent healthcare services in the United States public school system. So, what is telehealth? Telehealth is the utilization of telecommunication platforms to provide healthcare services to people in alternative locations. So, schools often work closely with occupational therapists to provide services for students throughout the day. The purpose of this study is to compare the satisfaction of services provided via telehealth delivery and compare it to typical in-clinic services. So the data was collected through a convenience sample of using a survey of 37 pediatric occupational therapists across the United States. And the themes I found from this study include the effectiveness, satisfaction, benefits, and challenges of telehealth service delivery according to these healthcare providers. Telehealth utilizes technology to interact with healthcare providers in alternative locations. This is a cost-effective and a time-efficient way to receive healthcare for individuals with various needs. From a young age, the school curriculum typically occupies the majority of a student's time. This leaves limited availability for extracurricular activities and other necessary responsibilities, such as healthcare appointments. This is essential because students have little time to participate in preferred occupational performance activities. Utilizing telehealth during a typical school day could resolve several issues. However, it is important for researchers to understand the risks and benefits for this delivery method. For traditional schools, utilizing healthcare providers' research on the efficacy of telehealth is limited as found by research conducted in a recent literature review. This review is available and it indicates a predominance of studies addressing usage and potential benefits of telehealth and the deficiency of published evidence addressing its efficacy. So there is limited research out on telehealth. However, this study, the purpose of this study is to research telehealth in the school system based on pediatric occupational therapists. So to conduct my literature review, I used websites such as ProQuest and EBSCOhost to find my articles, and I used keywords such as pediatric OTs in the U.S. public school system, OTs in school, pediatric OTs, telehealth in the school system. I used these keywords to find the most relevant articles for my study, for which I used pretty recent articles anywhere from 2010 to the current year. So telehealth is a relatively new concept and it's even newer in the school system. So a little bit of history about telehealth and telemedicine. It was first used in the 1850s to the 1900s, where people used telegraphs and radio to communicate with others, and as time went on, it became more advanced, such as radios, telephone networks, TV, and now computers, which all use satellite and internet now. So a recent study in 2015 by Scott and Mars detailed the first ever usage of what is now considered telemedicine. This article kind of gave us insight of how we can actually use healthcare with telemedicine to further advance the setting. And then in 1960s and 1970s, the government finally began funding telemedicine research and allowed for new advances such as Windows 10, Oculus, internet, touchscreens, and tablets, which are now readily accessible and readily available for anyone that needs it. So another one of my literature review topics is telehealth in schools. So as I said previously, from preschool until our teenage years, education is a major part of our lives. This leaves very little room outside of our typical day to do activities, healthcare appointments, and others. So this requires a need to accommodate alternative services that could be integrated into the schools and the students' education. Schools can offer the time and the space for healthcare and rehab, which a child may not otherwise receive outside of their education. Another point in this literature review for telehealth in schools is that the solution to personnel shortages can mean telehealth. So there's many PTs, OTs, and speech-language pathologists that work in schools, and their caseload is often too large with very little time, and treatment becomes less effective. By using telehealth, practitioners can eliminate time and turnaround time for each client, making the overall process much more effective. Another important topic in my literature review was diagnoses. So, telehealth delivery is a style that can accommodate many different diagnoses. This means that practitioners can tailor each intervention and education method and techniques to each child to help improve performance skills and coping strategies that will later be translated to the classroom. So, a qualitative review written by Langkamp in 2015 details the benefits of using remote delivery service instead of traditional in-person treatment. So two of these presentation styles are synchronous and asynchronous. Synchronous allows for live communication, which can help with question answers and individuals that may not understand, while asynchronous uses a pre-recorded session for clients to listen and participate at their own pace. So the satisfaction rate for both of these is very, very high regardless of the discipline. However, the pre-recorded style is favored due to the comfort of looking back at certain parts, session notes, and the individual's pace that each client can set. So both of these styles are very helpful for any diagnoses. However, diagnoses plays an important role in the learning style. So diagnoses can play a major role in the success of telehealth. Some of these diagnoses include complex medical needs, autism, mental health, diabetes, intellectual disabilities, and learning disabilities. And while these are not the only ones, these are very common for telehealth as they don't require as much hands-on care as many other diagnoses. So children with complex medical needs often receive care multiple times a day, which can impact the structure and continuity of their day. So kids have to receive services at school, such as speech or physical therapy or occupational therapy. Then they'll have to be pulled out of school or out of class to go participate. Instead, they can just go to another room, do their therapy, and then return back to class. Another article written by Gloff in 2015 details a meta-analysis about mental health and the expansion of the mental health field to compensate for a growing need of services. The results showed that 70 to 80% of children receiving mental health services receive treatment at schools. So this can also be a very important use of telehealth as well. So telehealth, as well as the healthcare field as a whole, have made incredible growth and advancements over the years. So one of the articles by Burke and Hall conducted a systematic review to detail the growth of telehealth and explaining how the Affordable Care Act has expanded access to medical care for millions of Americans. So this, along with the Center for Medicare and Medicaid, had advocated for the use of new technology in the healthcare field. So these organizations urge for advancements in anything to eliminate barriers for access to care, which promotes improvement in new research, education, and expansion of the field. Another article written by Love in 2019 detailed the drastic growth of telehealth and school-based healthcare systems by conducting a review of medical data. So, the federal organizations have provided access to care to over 10,000 schools and to over 6.3 million students. So, in the past 18 years, school-based healthcare systems have doubled, and in the past 9 years, telehealth usage has grown from 66 reports to over 450 reports just in schools. So limits and barriers was another major topic on my literature review. Some of the barriers that limit access to care include lack of research, privacy, confidentiality issues, funding, and the perception of use. So funding is a major barrier as organizations will not fund a project with such limited research. Same thing, individuals are much less likely to try something if there's not an abundance of research to prove its effectiveness. So this can impact the growth of any emerging field such as telehealth. A narrative journal written by Schwam in 2014 implemented strategies to improve the function of telehealth as a whole. So this author identified telehealth as a disruptive innovation, which means that it disrupts our current way of life to improve the conditions. So these strategies must be identified to ensure positive experience and translation of skills to other activities. So some of those strategies identified in that research article include understanding patients and provider expectations, understanding differing outcomes, for different delivery methods, deconstructing traditional healthcare encounters and being open to discovery, being mindful, and redesigning care to improve the value and overall being a visionary. Another topic on my literature review is policies, laws, and regulations. Over time, states have been adopting their own telehealth policies because there hasn't been a state or a regulatory board, but there is one now. Organizations have struggled to create and organize policies due to the rapid advancements in technology, so this has resulted in states adopting their own policies. A recent literature review written by Caloro and Associates in 2014 detailed the regulations that inhibit the use of telehealth. This includes those state-to-state policies. So these organizations have struggled to organize these policies, creating barriers in access to care. Another major contribution is the Affordable Care Act, which allows for access to health care by providing care for millions of Americans. And while consent is required regardless of a setting, scenario, the privacy is a more challenging barrier to access in certain settings, such as telehealth. HIPAA, the Health Insurance Portability Accountability Act, this was created to ensure confidentiality and privacy to each patient and their authorized personnel. Another limitation to access to care is billing and insurance. So telehealth, while it continues to grow, there's a lot of insurances that still will not allow telehealth to be accommodation for individuals that cannot make it to their appointments. However, Blue Cross Blue Shield is one of the first companies to include telehealth into their policies, while other companies began to follow in their footsteps. It eventually became mandatory. So while telehealth does not completely replace primary care visits, it does allow extra and alternatives to receiving medical advice and consultations. So researchers have projected the telehealth market to reach over $36 million in revenue, with 91% of employers using this method by 2020. It is now 2021, which I'm interested to see the research, what it has reached now, but overall telehealth continues to grow and continues to become a big part of the healthcare industry. Satisfaction was a major part of my literature review, as it is one of the main points of my research. So telehealth can improve the caseload of healthcare professionals by eliminating travel and increasing productivity to meet the unique needs of school-based healthcare. So these school-based healthcare systems, student receives healthcare during the day, which makes the therapeutic relationship vital to the success of the treatment. A qualitative study conducted by Sarawi in 2017 and his associates attempted to understand themes in caregiver perception. So prior to beginning the program, clients and caregivers had consultations with their practitioners via video conferencing to establish a relationship and develop a plan. The themes that emerged include that the caregiver felt prepared and ready for treatment, and that he or she had a good interaction with their client. Another qualitative study attempted to understand the satisfaction of treatment in schools from all parties involved, including the client, the caregiver, the practitioner, and the school itself. So based on the 2-year study, results show a high satisfaction rate for practitioners, the caregiver, the client, and the school administrators, resulting in decreased amount of travel time for the therapist, saving almost 3.4 hours of work and travel time, as well as money saved in emergency visits or practitioner costs. So the final section of my literature review is future practice. How could telehealth impact future practice of occupational therapy? So as an emerging practice, telehealth continues to prove itself as an efficient alternate service delivery model. A systematic review conducted by Hilty and Associates in 2019 looks at various models that can improve the use of telehealth for future practices. For best outcomes, it is important to understand how technology and academics interact with each other, while also throwing healthcare into the mix. Telehealth can kind of provide a bridge to allow children to have healthcare in schools. So using the technology that these kids are already using in school, they can receive the healthcare that they need while they're still in class, while they take a break, in all sorts of different ways. So here is my research question. I chose to do this study because I feel that the practitioner satisfaction plays a major role in the use of therapy tools such as telehealth. So my research question is, what are the limiting factors, both evidence-based and perceived, of telehealth service delivery for therapy services provided in the United States public school system as it pertains to the level of satisfaction for practitioners? The overall objective of this research is to learn about the impacts of telehealth in the school system based on the satisfaction of pediatric occupational therapists around the United States. So my survey was released in 3 waves using a strategically selected survey administration method. I chose Google Forms. So the survey was collected over a 2-month period, giving participants ample time to complete it. The targeted population consisted of pediatric OTs, and I utilized a small sample of 37 participants. So the type of questionnaire was open-ended using a convenience sample. A final list of 75 email addresses was compiled, and a draft was developed to distribute to each participant, overall receiving only 37 back, totaling my participants to 37. The first wave of my survey was distributed in January of 2021, which consisted of 25 contacts and emails, which I received 4 responses. The second wave was distributed in February of 2021, which also consisted of 25 contacts and 9 responses received. And the third and final wave was distributed in March of 2021, which also consisted of 25 contacts and 24 responses were received, bringing the total responses to 37. So for my methods and design, I used grounded theory approach. This was implemented to identify emerging themes from my research results. So grounded theory itself uses the previous research, the grounded data that has been collected and organized to generate theories. So this approach was chosen because this theory could better analyze the qualitative open-ended data by identifying emerging themes rather than grouping these results into pre-established categories. This facilitated more thorough analysis to better fit my desired outcomes. So my findings. The reason I chose this topic is because very little research has been conducted and published to date, which evaluates the efficacy of this tool as it compares to traditional in-person services, which indicates a need for further research. So findings from my literature review identified telehealth as a functional method of healthcare service delivery, one which is projected to become widely used across the nation. So the results of my study differed immensely from my anticipated hypothesis. In my literature review, research projected practitioners to produce a positive reaction to telehealth. However, most of my responses found it to be unsatisfactory for their needs. After organizing my data, I found common themes that fit with each of my participants' answers. These include practitioner satisfaction based on my results from pediatric occupational therapists, certain diagnoses that work better with telehealth, intervention types that also work better with telehealth and with different students and what they might be learning in school, and the growth of the field as a whole. These are 2 questions I asked in my survey. The first one, I chose to identify where my participants were currently employed. I did this because I believed it may affect the outcome of my study. For example, New York was a hotspot for COVID-19, which might increase the amount of users of telehealth. I also chose to ask the amount of years of experience each participant had, as older adults are less likely to use or have experience with technology, making them much less likely to use it. I also chose to identify different media platforms that my participants chose and why they chose them. This included Zoom, Google Meet, Microsoft Teams as the main preferred media platforms. These include screen sharing, chat boxes, and other types of add-ons that better enable practitioners and clients to engage in interactive therapy activities. As stated previously, diagnoses plays a very important role in the success of telehealth. So I asked my participants to identify diagnoses and interventions they use most commonly in telehealth. And some of these include autism spectrum disorder, sensory processing, ADHD, cerebral palsy, Down syndrome, and just general developmental delay. The intervention methods that my participants prefer include the print tool, handwriting without tears, other worksheets addressing various skills such as executive functioning, perceptual skills, sensory integration activities, boom cards, social stories, and parent-caregiver education. So most commonly, my participants preferred music/movement activities and visual perceptual interactive games, worksheets, yoga, sensory calming activities, and self-care tasks for their clients. I asked my participants to detail the pros and cons of using telehealth as a delivery method. So pros include the ability to do therapy anywhere, the flexibility of treatment, limited travel, readily accessible home and school routines, readily accessible school assignments such as handwriting and other worksheets, as well as parent and teacher participation and rapport. So some of the cons identified by my participants include minimal therapeutic interaction and physical guidance, technology issues, environmental distractions, limited therapy tools, parent-teacher guidance may be necessary, inattention and focus on the screen, limited visual feedback for therapists, and there's no physical prompting that otherwise students may need. These are just some of the pros and cons listed by my participants, however they may be different elsewhere. After going over my findings from my research, I analyzed my data, and after collecting my responses, I organized my research to a Excel spreadsheet. So this allowed me to compare my responses to each other. So some common themes that were identified from my results include practitioner satisfaction, diagnoses, intervention types, and growth of telehealth. So overall, my results showed that telehealth was not a preferred tool for delivery, and most practitioners did not find it satisfactory for typical treatment. However, they did find it satisfactory for the current conditions of the global pandemic. Another major theme found in my research is practitioner satisfaction. So satisfaction is the most important, if not one of the most important factors that determine the success of many healthcare tools. If the practitioner is not able to use that service or that tool implemented by their employer, or they prefer not to use it, then the tool becomes useless. Majority of our participants were also dissatisfied with this delivery method as it's not efficient for their needs. So my participants needed more hands-on care than they could get through telehealth. Practitioners were dissatisfied with the time constraints of fitting occupational services into a full day of classes, as well as the noisy environment that the kid is placed in for their session, regardless of if it's in an isolated room. Another concern includes the time constraints on therapists to complete each session, plan activities, and communicate with the supervisor helping that student. So telehealth requires extra time to plan, create the activities required for using specific materials, specific tools for that activity. The communication is also a burden, an added burden for the therapist, as that person has to contact the teacher or the parent or whoever the supervisor is to coordinate that session. My participants also identified that the diagnosis heavily influences their ability to participate in each activity. While the occupational therapy treatment is very individualized, it's even more important for telehealth to tailor each activity to the patient's skill level and diagnosis to become efficient in a school setting. So not only is there limited time during any telehealth, but especially in a school setting. Also, by eliminating the one-size-fits-all mindset that practitioners often have, telehealth helps them to save time, materials, and they can lower their stress level to ensure that each session runs smoothly and the patient is making progress towards their goals. The growth of telehealth remains steady and within the past few years and continues to grow over time. So, a recent literature review showed an immense jump in the usage of telehealth in the past 18 years. So, it detailed the drastic growth of telehealth as a tool and in school based healthcare. So, the results of this study that Love in 2019 found show that federal organizations have provided access to over 10,000 schools and to 6.3 million students, growing from 66 reports to over 450 reports just in schools. So the global pandemic definitely forced organizations to adopt this delivery tool, but now it has become a preferred tool for healthcare professionals. And as you can see on the left, there's a small chart that shows you just how telehealth can help expand each area. So populations, it can help expand the Medicaid populations that use telehealth, services and payments, providers, there's a lot more providers that are allowing this, and the technology. Technology is now made to have cameras, microphones, and everything needed for just typical therapy sessions via telehealth. So my research limitations include a lack of understanding of telehealth services in the school system. This isn't just in the school system, it can be anywhere. There are many benefits to using alternative delivery tools, however, there is minimal research supporting its services. So if someone is uncomfortable with the lack of evidence, they're much less likely to use this tool. Findings also show that there are very few computer services and apps created for the success of telehealth, which creates a barrier to success. So now there are very many apps that have whiteboard, that have drawing, and that have screen sharing, which provide more access to telehealth use. Research shows that telehealth can be an efficient tool for consultation purposes in healthcare, but not for continuous treatment, such as in schools. Research results were consistent in proving the lack of evidence supporting rehabilitation services in the school system. So the sample size can also play a role in this. My sample size was only 37 responses, 37 participants, so this also plays a role in my limited evidence. So it's a very small amount for such a large population. So how does telehealth impact occupational therapy? So more research provides enough evidence for practitioners to be confident in this tool. So my research, as well as hundreds of other people, have been researching this topic in attempts to make it better for occupational therapy practice. It also provides more coverage for individuals that need therapy. This includes remote locations, schools, and anywhere that it is needed. And while the hands-off approach of telehealth poses a unique limitation, it does not take away from the overall experience and the satisfaction of delivery. Telehealth has impacted the field of occupational therapy by providing alternate forms of delivery, cost efficiency for services, and availability for practitioners. So by implementing telehealth in OT, it allows individuals to receive services that they may not have received otherwise. And for schools, students can implement learned skills, education, and training into their everyday classroom. In conclusion, telehealth is an emerging style of delivery and it's utilized in a variety of different healthcare professions. So while the outcome of telehealth services is not widely researched, it continues to grow, paving the way for new and improved delivery tools across medical practices. This research provides insight to potential barriers to its success in practice. By identifying these barriers, researchers and other healthcare professionals can find new ways to improve current services. So this type of service delivery allows clinicians to reach remote and underserved populations, as well as less popular populations such as schools. It increases the caseload and productivity in the OT field. With research to improve delivery, telehealth can be the tool that is needed to provide further research. This can help grow the field of telehealth by expanding access to care, and with advancing technology, more opportunities will arise to expand the usage of alternative delivery methods with this style. So my acknowledgments, I would like to thank my parents for their constant support in my education. And I would also like to thank my classmates and my friends for their feedback and encouragement as we continue our education and we come to a close with clinicals in this program. My clinical instructor, Jennifer O'Hanlon, has been an immense help during my research process and helped me with finalizing my project. And I would also like to thank my professors and my chair, Dr. Mullaney, for providing guidance and assistance during this whole process and throughout my educational experience at Tennessee Wesleyan. Please feel free to ask questions, and thank you so much for listening.